Hello and welcome to yet another edition of the Health Wrap by the Hindu. This is in video format, everything you can learn about health on the Hindu through its various formats. Through the Health Wrap, we aim to bring you news, analysis, views and explainers from different parts of the world and point you out to health news you can go back to and read on our website. Do not forget to watch out for our expert segment, and today we welcome the very articulate Dr. S. Soundari, Regional Head Clinical Services, Dr. Agarwal's Eye Hospitals. Since July is observed as Healthy Vision Month, we thought it would be a good idea to give you, our audience, a few tips from a professional on routine eye care. We are also introducing a fresh segment from this week, Reporter on Call, where we bring in a reporter from our bureaus to talk about a key health story they've done for the week. This week it is Abdul Latheef Naha, who has had a tough time covering all the angles of the Nipah virus story in Kerala. Today I have with me Zubaida, who is also on the health desk. What do we have this week, Zubaida?
The big news this week, Ramya, has been all about Nipah virus resurfacing again in Kerala. Kerala has now seen several episodes of the Nipah virus outbreak over the past few years, and they are quite primed to tackle the virus. But there has been tragically one death so far. An 18-year-old passed away, and several other persons continue to be under active surveillance.
And this is also about why do we get excited when there is a Nipah case? Because so far there have been two confirmed cases, lab confirmed cases. The problem is that it has a very high mortality rate between 40 to 75%. That is like phenomenally high. So the only way to go about this is prevention. A significant number of them are healthcare workers. Which means that you're burdening the healthcare system, which is supposed to take care of people with infection or symptoms. So I think the only way ahead is prevention. We know that fruit bats, eating fruits or food contaminated by fruit bats is a possible reason for contracting Nipah. So I think the way ahead is to look at how do we restore sometimes these habitats which we have eroded over years because of human activity, and we should also involve the public in a one health approach, which is looking at animal health, human health and the many factors that influence the migration of viruses from humans to animals and vice versa. So I think this is something that the government will have to focus on.
Absolutely, a One Health approach is the future and it's the way to go, because if we don't take our environment and the animals that live in them in consideration, then the episodes of zoonotic diseases are only going to increase.
So, Latif, we all know that Nipah has gripped Kerala once more, and this is not the first time that Kerala has had to deal with it. We talked about it a little earlier on the Health Wrap video. But why don't you give us like a quick status check on what the situation is now and what the state government is doing about it?
All right. In fact, a little more than a week ago, we reported on a single day. We reported two Nipah cases, one from Palakkad and one from Malappuram. And one of them, that's from Malappuram, that girl had the report came. She tested positive after her death. She had shown signs of encephalitis and severe encephalitis, and the other woman also, and that woman died, and soon after they got the suspect. I mean, we have as per the Nipah protocol, the government can only confirm Nipah only after the Pune Virology Institute report. Before that, we had they conducted tests at medical college at a laboratory in medical college, Calicut Medical College, and they knew where it was positive, but they cannot, as per the protocol, they cannot consider it, they cannot finalize. So they were waiting for the report, and soon after the Pune report came, it was confirmed. So two cases came together, and both three districts had to be geared up for Nipah to counter the spread of to prevent any spread of the disease, the virus. So immediately what they did was they started identifying the contacts of the persons, the contact tracing, and at the same time they they tried to they declared what do you call it, containment zones, just like COVID virus. Uh, six wards, six civic wards in Palakkad district, as well as 20 wards in Malappuram district were declared containment zones, and that means actually it is within three kilometer uh, periphery, within 3 kilometer of the house of the Nipah infected person uh, was was considered containment zone. So these 26 wards together were contained, and they declared restrictions. That means they declared crowding was banned in those places, and people were asked to mandatorily wear masks. And of course, just like COVID, other restrictions were imposed, and people moving out, coming out of those containment zones were restricted. People were restricted, and but still, it was there was not unlike COVID. During COVID time, we had very severe restrictions initially, but unlike that, now people know what it is. So more or less, it was there was no, and the police were not involved much. People had their own freedom. There was no restriction on freedom and all. But generally, those restrictions were in place, and educational institutions, of course, in those containment zones were closed for. In Malappuram right now, they lifted yesterday. They lifted the restrictions in Malappuram, but in Palakkad the restrictions continue. Even now, they continue. That's the situation right now. And one person, the person affected in Palakkad, is still battling her life, battling for life in ICU in Kozhikode.
That's the danger of this virus, isn't it? It has a very high
Yeah,
case fatality rate.
it is deadly, and still you don't know where and how it comes from. Still, but we take preventive measures, and
You
now the
said
state
a
is
lot.
familiar. Now the state knows how to battle it out, how to tackle it. So we have a protocol. Exactly, soon after the confirmation comes, they form some 26 committees involving health and other personnel. So they start working on it. The whole health machinery will be after this. Usually, that is the practice, and they make it a point that any announcement, any declaration, any information sharing is done by the minister only. Officials of lower level officials, nobody shares any information. That's actually for a reporter. That's a big challenge for us. Getting information, getting access to information. That's a very difficult thing.
So, would you think that the people are fairly cooperative? You said that containment zones have been declared, but people now know what this is like and they do cooperate with the health department?
Yes, people are cooperative. By and large, people are cooperative because they know they had precedents. They had the COVID situation there in their mind. They know what it is. They are more or less cooperative. So, for example, the main thing they have to avoid is not going out but congregating. They have to avoid congregations. Say, for example, if we are holding a marriage and all, you have to alert the public, alert the authorities. Other general congregations are avoided. So in general, there are no issues so far because we had for for Malappuram district, we had four cases back to back within a year. So no issues as such.
That's good to hear. You spoke a little earlier, Latif, about the challenges of reporting, one of which is obtaining information, since there is Kerala has restricted it only to the minister being able to give any information at all. What are the other challenges, and what has it been like reporting on Nipah over the course of several years now?
True. Challenges. The one big challenge is since they don't share any information at the lower level. Uh, that's a big challenge because they lower level officers they're all afraid of higher ups, so they don't share anything. Uh, that's a big challenge for us. We have to wait for the minister making the announcement in the evening. So that's one. Getting information, getting access to information is one challenge. The second thing is the restriction of movement. uh, we because of containment, we too have to be careful when moving in and moving out. And restriction of movement on people is also a challenge for us because they won't be, even if we go to houses and go to places in containment zones, some people don't come out. I had that experience. People don't come out of their house. because they got scared, and that kind of experience we had. Another thing is the risk of infection is also there. We too have to wear a mask, and I still remember I went to two places last year in September case in Vandoor, a 24-year-old man, a student from Bengaluru. He came home and he got Nipah infection and he died. Soon he died, and I went to that house. The trauma the people witnessed there, they were all upset and they were all angry also because of some local issues there. When this person was taken to hospital, he was in a very, what you call, a mentally deranged state, and he had this encephalitis syndrome. Still, initially the doctors couldn't identify, and they were all blaming those doctors and the health system. They were yet still. So we had to face that anger as a reporter. I went there into their house because we were doing a spotlight on that. So I had to face that anger, and I spoke to her and calmed her, and yeah, that was a challenge. And in the immediate case, 2 months ago in Valancheri, and one 42-year-old woman was infected, and she was taken from her home in a critical situation. And after that, nobody had entered into her house, not even any neighbors, because they were all told not to move around, not to get exposed to. And when I went there as part of doing a spotlight, I was the first one to enter that house, and because to get a scene of that house, to get a feel of that house, I went there and went around the house, I peeped into the kitchen also. So all this, and people were telling me when I came out, somebody was telling me, "You went there, you have done a mistake. You shouldn't have gone there." That was what people were saying. I didn't bother, but still, that was a challenge. After all, you are going into a place where a deadly virus is supposed to have been there. So those kinds of challenges we face during the reporting. But still, Nipah being a deadly one, and still I'm not a health expert. I'm not specializing on health. I'm a district correspondent, and that too of two big districts, Palakkad and Malappuram. Malappuram is the highest populated district in Kerala. Palakkad is area-wise one of the largest districts. Two big districts. Both of them actually together constitute 30% of Kerala. So is it still for me? I enjoy that report because you get to know a lot of things. You can learn things about a new disease. So I enjoy it, even though it is challenging.
Understood. Thank you so much for speaking to us today, Lateef.
And talking about infections and vaccines and viral diseases, this week we also had a lot of misinformation about the COVID-19 vaccine and its link or supposed link to sudden cardiac arrests and deaths, especially in Karnataka. In fact, the Karnataka government set up a committee specifically to look into this, followed by a Union Health Ministry statement.
Right, and we have reported extensively about this. In a way, I'm so glad that we are talking publicly about vaccine safety and efficacy at a time when anti-vaxxers are gaining ground, particularly in America. I mean, it's going crazy out there, literally. So what we have learned from both the Karnataka study as well as the ICMR study is that there is no link between sudden cardiac deaths and COVID vaccination. So the studies have been able to prove that either lifestyle factors or some kind of genetic component has caused this sudden death, and that taking COVID vaccinations or vaccinations is perfectly safe.
Yes, it's never too late to consistently reiterate that vaccines are safe and help protect the entire community from vaccine preventable diseases. And talking about vaccines, India, according to a Lancet report, hasn't done really very well post-pandemic when it comes to vaccination. The report indicated that there were 1.44 million zero-dose children, which means that 1.44 million children did not receive the vaccines that they're meant to receive at birth.
Yeah, this is a very, very significant concern because we are looking at vaccination as a tool of producing herd immunity, which means a certain portion of the population is inoculated, which means diseases can't strike the population, particularly in outbreak form. So, it is very important to ensure that there are zero dose children and to make sure that the government runs a very, very integrative and committed immunization program.
And not just zero dose, we have to ensure that even partially vaccinated children get fully
absolutely.
vaccinated. So, moving on from vaccines and viral diseases and other things, let's talk a little bit about the developments in healthcare, which is, the word on everyone's lips these days seems to be artificial intelligence. We have a couple of stories about this, about artificial intelligence in healthcare this week. One of these was that researchers in the UK and in Chennai are working on using AI and social robots to combat loneliness and to signal to researchers what the early signs of dementia could be.
Yeah, I think there's phenomenal, research happening into healthcare these days, and a lot of breakthroughs coming through. Probably because we are all on social media and everything comes on social media first, even sometimes before it hits a journal. But it's encouraging. Some of this is encouraging. Some of the research is encouraging, particularly when it talks about handling populations that are underserved. And given that India is moving into a grey economy, into a grey nation, I think it's very important to look at solutions to handle the number of senior citizens we will have as a nation, not very far off. So, it's important to look at that, which is why this study is important. But we also had a story this week, I'm sure you recall, about how AI is helping create better, efficient EMR models, electronic medical record models, and that is also one area where I think the focus will be on, simply because we have huge populations, and to have a database that will be secure, safe and usable, that will be a big challenge.
Absolutely. Even for us, if we go from one hospital to another, you have to constantly carry about all of your records. To have them all electronically saved, to have them accessible to the patient and to the healthcare team is so important, isn't it? Continuing to speak about tech in healthcare, some good news this week was that content moderators for big tech have pledged to unite to tackle mental trauma. A lot of us hear about, and a lot of us feel it as well when we constantly scroll through social media or use the internet on a daily basis, that there is some level of mental stress that goes on, isn't there?
It's so true, because this information comes from these moderators themselves. These are the people who are tasked with ensuring a certain kind of content goes onto their platforms. This includes Meta or TikTok. Of course, TikTok is banned in India, but these moderators have reported a range of health effects emanating from consuming this content. So, I think it's important for the big tech, like big pharma, there's big tech on the other side, for them to take efforts to ensure that they have measures to help people overcome anxiety or have a safe experience while browsing these platforms.
Absolutely. And talking about tech, it's not all good news all the time. One of our stories was about how it's really easy to make AI chatbots lie about health information. And that was a very interesting story because it's a lot of us use Google to find out everything we need to know about our health, don't we?
Yeah, and I was chatting with one of our colleagues yesterday, and she was talking about how Gen Z are going to chat GPT to find out what disease they have based on their symptoms. And chat GPT is just generative AI, it doesn't really help. In fact, remember a few weeks ago we had this story about how even the large language models can be tweaked or fixed to say a certain thing, even in healthcare. So, while we celebrate the power of AI, I think we should also be careful and conscious of the loopholes that exist and be sure that we fix these loopholes before we start using this and relying on this technology.
And speaking of technology, we must also always remember to be careful about the kind of information we share online. We had a story about the dark side of period tracking apps, the kind of information that all of these apps that we are now all of us use on a daily basis, the kind of information that they take from us and what they do with that personal health sensitive information.
It's frankly scary how information that you unassumingly submit online can throw up so many dark sides later, even without your knowing or notice. So I don't know if everyone who submits information is conscious of this side. So I think there is a role for it for the regulators. There has to be regulation soon that will guarantee the misuse of technology in healthcare.
Moving on from tech, let's talk about something we touched upon a little earlier, which is the aging nation, our aging country. We had a few interesting stories this week about aging, didn't we? One of these was the Bharat study, the biomarkers of healthy aging, resilience, adversity and transition study.
Yeah, very key study, and I'll also like to tell our audience, our readers, that an ebook on aging, Shades of Grey, is in the works and it will be out soon. Make sure you download that ebook if you're a subscriber. Going back to Bharat, I think it's important to have baseline parameters set for an Indian population. Today what we use are by and large Western parameters, and it's about time that we ensure that we have our own set of health guidelines, baselines, parameters which will measure the rates for our Indian population. We know that ethnicity plays a great role in how you measure values. So I think as far as these go, we have to ensure that the Bharat project is not only takes off well, but sustains itself over a period of time and is able to cover the range of diseases, not only for an aging population, but also a younger population. Look at the curve of aging itself.
And talking about aging, another story we had was about anti-aging and wellness supplements in India. We had the story explore the fact that this is not a very well regulated sector, and so caution is really advised. If anybody is using anything to do with supplements, especially health related, it is always best to consult a doctor, isn't it?
Yeah, totally. There's no two sides about that, and how many things lapse into the area of cosmetology or aesthetic grooming influenced by social media is frankly quite disturbing. But there's also, while we're talking about aging, let's also talk about palliative care. That's a huge gap that exists in our country today. We might even have services for senior citizens, geriatric population, but what percentage of palliative care are we able to offer them? That's a question that is really dicey. I don't think we have enough. I think the studies also look at palliative care. It's not, while technically it's believed to be end of life care, it's not quite that. It's about ensuring patient comfort and stability and making them feel content and happy at whatever situation they are in. So that's something that we'll have to consider.
Yes, it's absolutely vital. Palliative care is still available in very too few centers in India, even though the rest of the country also needs them. And we as a country seem to be really reluctant to discuss end of life, aren't we?
Yeah, end of life is seems to be a very sentimental issue for us, but I think taking decisions about end of life care, planning for our eventuality, I think is very important. Thank you so much for joining us today, Doctor.
Thank you.
So good to have you on the show. So we know that July is being observed as Visual Health Month, and so we thought it's a good opportunity to talk to our audience, our readers, about basic tips about eye care and what should we do. So initially, to start off, what is the significance of a Visual Health Month? I mean, we have so many days. We have days for cataract and so many other days for visual health itself. What is the significance of this month?
So, visual health as such is becoming a big issue across the world. So, if you look at the incidence of myopia, it's almost like doubling, and almost 50% of the population will be myopic in another 20, 30 years. So, like that, if you look at every disease in the eye, the number is increasing only. So, what we need to do is take care of the eyes, and the visual health is very, very important. So, prevention is always better than cure. So, as a preventive, what are the measures which we can take to maintain the visual health of the eye? So, that is very, very important. So, that is what we are going to talk to you about.
Great. So, when you talk about the various aspects of prevention itself, what are some of the tips that you might like to give our audience?
So basically, from starting from childhood, I would like to go age wise. So if you look at the age group of preschool children, so preschool children examination should become mandatory. So before they enter the school, they should have an eye examination. If you look at a lot of children, they are having astigmatism, myopia, because the incidence of them having a digital screen time is from birth. So when the child is 2 months, 3 months old, from then onwards, they are getting exposed to the digital screen. So the incidence of myopia is increasing, and even the astigmatism, if you look at the number of population having an astigmatism, is definitely increasing. So preschool evaluation is very, very important for finding out whether the eye is all right or whether they need glasses. Because if you don't correct the power at the right age, the child can develop amblyopia or a lazy eye. So this lazy eye, if not corrected at the right time, can be like the vision can be lost for life. So the maximum age group within which the amblyopia can be corrected is around 10 to 12 years of age. Beyond 12 years of age, even if you identify and try to treat it, it becomes very, very difficult to treat the problem. So the vision can be deprived for the child for life. So if you just do one small test, an eye examination, we can pick up early amblyopia and we can treat it, and it can be cured. So at the right age, if you're able to treat it, it can be cured. So eye examination in children, and definitely the digital screen time should be reduced for children, and healthy diet. So regular eating of lot of green vegetables and fruits should be included in the diet. And apart from that, good exposure to sunlight. So the sunlight exposure also has come down a lot among children because they are bound in the house. So they go to school, come back, they are on the screen, they are doing their work on the screen, everything is on the screen. So they're not going out to play. So good exposure to sunlight, all these are very, very important for the health of the eye as far as the pediatric age group is concerned. So when it comes to like beyond 18, 19 years of age, the computer vision syndrome plays a major role. So once they enter into college or when they are in work, the computer vision syndrome is one major issue which everybody is facing. So what is computer vision syndrome? Basically, it's nothing but a dry eye and an eye strain because of the exposure to the screen for a long time. So how can you